everyone, I'm Kelly with North Shore Eye Care. I am sitting today with Dr. Samuel Baharestani, and we are going to talk a little bit about a topic that's very popular in social media today. It's trending about Kylie Jenner and the lip plumping challenge that she's been talking about. It's going viral, everybody's trying it, and people are definitely getting hurt doing this. So we want to let you know that there are definitely safer ways to enhance your appearance. I'm pretty certain, especially after just looking at some pictures of her before and after from a few years ago, that chances are she's not fessing up to it, but she's probably had some fillers put in her lips. So Dr. Baharestani, would you mind just telling our viewers about fillers and, what's involved?
Sure. So it looks like this thing that's trending on Facebook and Instagram, YouTube, all that sort of stuff, this Kylie Jenner lip challenge, is a way for people to bring light on to the different types of lips that people have.
Right.
Some people have thinner lips that they're normally born with, other people have thicker lips, and things can be done to sort of enhance the appearance of the lips. Kylie Jenner, it looks like she's had some filler injections, cosmetic injectables done by a physician to kind of make her lips plump up. You can see a big change in photos of her from a few years ago compared to what she looks like now. The thing that I'm worried about as a doctor is that a lot of people who don't have experience with fillers or don't have experience with lip augmentation are doing kind of things that they shouldn't be doing to get their lips to be larger. You'll see all these videos online about people sucking on straws or sucking on shot glasses to actually cause inflammation and injury to their lips to get a temporary plumping of their lips. And that's not really the best thing to do because sometimes that can lead to permanent scarring and even really long-term effects that could be really bad. So injectable medications for the right patient like fillers, Restylane, Juvederm, Radiesse, Belotero, all these sorts of things, Voluma is another good option, is a great thing for patients who are looking for cosmetic lip augmentation, not sort of these at-home remedies.
Right, because they've been studied and, done in a professional setting. They can be, very helpful to people who want to make some changes to their appearance. So that's one of the things that you do here for us. And could you tell our viewers a little bit about, how an appointment goes? Is it a consultation involved? Sure. Are there testing that's done? What is it?
Absolutely. So at North Shore Eye Care, we offer free cosmetic consultations for patients who are considering injectables like BOTOX and fillers, also people who are considering cosmetic eyelid surgery. Usually what happens is our patients will come, they'll have a private one-on-one conversation with me about what they'd like to do to enhance the appearance of their face. If it's wrinkles that really bother them, usually medications like BOTOX are a better option. If it's more just deflation and loss of volume in the face, fillers is the next best step. So what happens is if a patient is ready to have that procedure and they're a good candidate after reviewing their medical history and making sure they have no allergies, then we can do the filler injections or the BOTOX injections on the day of the consultation. Sometimes patients like to discuss it or bring in a family member to have it done, so that's always a good option too. They don't necessarily need to come with anybody. They don't need a driver or anything after the procedure, but it is always nice to have someone else there to hold your hand throughout the process.
If they do decide to have fillers, is there discomfort afterwards, healing involved?
So usually people will get a little bit of bruising with fillers, and it's the type of thing that I don't like to sugarcoat with my patients and tell them that they're not going to get bruising.
You want to be realistic.
Yeah, the realistic thing is most people will have a little bit of bruising, but that can be covered up with makeup later that day or the next day. What happens with fillers is people usually notice an effect right away, and then the effect lasts depending on the type of filler that's used. For certain fillers, that means 4 months of effect, others 6 months, and then certain fillers can actually last for a year or two. So depending on the site that we inject and the type of filler that we use, it determines how long the effect will last.
Right, thank you for watching. I want to remind you to also check out our website, www.nseye.com, and also find us and follow us on Facebook. If you'd like to make an appointment to meet Dr. Baharestani, please call our office at 631-265-8780, and you can speak with his surgical coordinator, Jennifer Keenly. She would be happy to help you make an appointment.